Now, hair loss occurs because chemotherapy targets all rapidly dividing cells, which is both the healthy cells as well as the cancer cells. Your hair follicles are structures in the skin filled with tiny blood vessels that make the hair. If you're not in cancer treatment, hair follicles typically divide between 23 to 72 hours, but once chemo starts to work, it will destroy those hair cells. And we just got to remember that many of us don't have hair growing back as we really would like it to. With chemotherapy, soft fuzz starts to come up within 2 to 3 weeks after chemotherapy ends, and real hair starts to grow at its normal rate at about 1 month after chemo, and then 2 months after chemo you should have about an inch of hair that will be present. From a radiation perspective, if you lost your hair after whole brain radiation because of brain metastases, sometimes it may take 4 to 6 weeks before even an inch of growth appears. The hair that is new will probably be thinner than it was, and you might still have a small bald patch at the top of the head. So again, just hold on to those wig toppers or other headgear that you've got. And with hormone therapy, if the hair is thinning from a drug like tamoxifen, it usually kind of balances off after the first year, but sometimes could last up to 5 years. Taking care of your hair, particularly when you're going through chemotherapy, and you know that there's going to be any kind of damage to the hair follicle, so to try and do as little as possible with your hair. And this would be both to reduce the psychological distress as well as minimize breakage and loss that comes from too much brushing, pulling, or styling of the hair. You can still shampoo and condition the hair if you prefer that, but more than once or twice a week is sufficient. You really don't need to do more than that. Now, if you cannot do without using any of these treatments here, when it comes to blow drying, try to do air drying if possible. Just let this go naturally. And the solutions that we would have if we really had to do it is to use some products on the hair. You've got products with heat protectants, and these will help reduce moisture loss. Some ideas of stimulating hair growth. 2 prescription drugs that are available for hair loss are minoxidil, also known as Rogaine, and finasteride, which is Propecia. Both of these hair loss remedies have proven to be effective at reducing hair loss and in some cases even growing new hair.